Tom? Good, thank you. Good afternoon.
Good afternoon.
Who am I talking to?
My name's Linda Spakauskas.
Linda Spakauskas. Good afternoon. Are you enjoying the Mela?
Yes, I've never been here before, but yes, it's very interesting at the moment.
Right. So what would I kind of like to find out from yourself is, first of all, is this your first time at the Mela?
Yes, it is.
What do you think?
Well, yes, it seems very interesting. I've had a little wander around and looking at all the different stalls there are. And I'm here because I'm an organ donor ambassador talking about organ transplants.
Are you a recipient of an organ?
No, but my nephew has donated, and my brother died 6 weeks ago and he donated his corneas.
Sorry to hear that. Yeah. So if this is your first time, are you surprised at the diversity of the stalls and the information?
Yes, I went a few weeks ago to something very similar in Liverpool, but it wasn't quite as big as this, and there was more activity from dancers and food stalls, things like that. This has got a really good turnout from what I've seen so far.
Good. So what do you hope that visitors will take away from your stall?
Well, I'm talking about organ donation. Lots of people think they're too old, or because they're epileptic or diabetic, they're not able to donate. However, I'm here to help dispel those myths and also to encourage people to sign up. Although it's an opting out system now for organ donation, you still have to talk to your family to make sure that you might have agreed for donation. They might not know that and might disagree. So we're here to dispel the myths and also to encourage people to donate.
What do you find the reaction of individuals that you're talking to?
Well, quite often they're surprised. You know, they think, oh no, definitely can't donate because of A, B or C. And we say, well no, actually, age isn't a barrier and lots of illnesses not a barrier. And lots of people will sign the driving licence form, and if you look on your driving licence card, the little photographic card, it will indicate whether or not you have agreed to become a donor. There's a number on the back.
Do you think a lot of people are aware of that?
No, I don't. That's one of the things. That's one of the things we're here to talk about.
Excellent.
Yeah.
So how far has your group come to be here today?
I live in Warrington. My brother and his wife live in Mela, near Blackburn.
Okay.
So we've come a little way, but it's worth it.
Thank you very much for your time. Have a good afternoon.
And you. Thank you.
Now.
Bye.
Good afternoon.
Good afternoon.
And who am I talking to?
I'm Steph Holmes from Chrysalis Transsexual Support.
And what sort of things do you get involved with?
We have physical support groups across the north of England for just drop-in and general support. But our main thrust is advocacy work with transsexuals and trans people in general, and gender diverse, and also doing workshops, presentations, and general support work all over the country.
So what would your workshops, what the contents of those workshops be?
They're generally, with the trans awareness things, it's an introduction to the terminology, because that always trips people up. Then moving on to typical transition. I use mine as an example, which shows people the sort of things that we have to go through. Then moving on to what to say. Don't walk on eggshells around us, things like that. When I'm doing presentations in high schools, the first thing that 14-year-old boys always ask me is, have you still got your bits? So questions like that are not off the table. Anything is off the table.
So where's your organisation based?
The head office is in Darwin, but we're pretty much mobile.
Really?
We'll go anywhere in the country. The furthest I've been so far is Bournemouth Borough Council.
Right. So what kind of agencies or offices do you speak to?
I'm a referral agency for children's services, for youth services, for schools. They refer in. I can refer out to the NHS youth services and children's services. I get a lot from social services referring in, and generally people get to know about Chrysalis and tend to refer themselves in. So
excellent. It sounds a very valuable and valued effort.
It's a lot of hard work, but I'm driven.
So, in terms of what do you hope that people get out of visiting your stall today?
I hope they will get information, primarily, of course, but I hope they get a brief awareness of what we are, because very few people know exactly what a transsexual is, and have no idea how many of us or how few of us there are, and things. So I think if people go away with just a bit better understanding, then I'm happy.
Steph, thank you very much for your time today. Have a good afternoon. Thank you.
That's all. Thanks an awful lot.
Good afternoon. Would you like to introduce yourself, please?
Good afternoon. My name is Amit Sinha. I'm a consultant orthopedic surgeon. I'm practicing in North Wales.
Oh, really?
And I've come all the way from a tiny village where I live in North Wales.
Which village is that?
It's called Harden.
I know.
Yeah, just 6 miles north of Chester.
Excellent. So where do you practice then?
I practice in a hospital at this moment in time in Glencree Hospital on the north coast of North Wales.
Excellent.
Very close to Rill.
Excellent. Good. So what actually brought you across today?
Oh well, this is amazing where I have come to. The Health Mela has several purposes, and I'm amazed at the same time thrilled to bits by seeing the crowd here, and it consists of a good section of the society, including ladies and gentlemen and transsexuals, as well as all of us, of course together with experts in the medical field, and that includes GPs and consultants, as well as experts from the UCLAN University as well. So I'm absolutely thrilled to see such a good mix of people who want to engage with us.
That's very good. You sounded very enthusiastic.
Yes, I am. Yes, I am.
And all the people we've spoken to today, I have to say, are of the same style and same temperament.
That's what, when I first came here, I was looking forward to it. The reason being, although I've been involved with Professor Ramesh Gupta in his work in the National Forum of Health and Wellbeing for the last few years, I have never actually attended a Health Mela in person because during the last few years the Health Mela has been online, and that is why I was so keen to participate in this.
It shows.
Thank you.
So you live in the Welsh Medical Authority.
Correct.
Yeah.
Yes.
Do you think this is something that would go down well in the locality there?
Yes, it will. Yes, it will. And I think it's vital for me as one of the spokespersons of the National Forum of Health and Wellbeing to spread the message.
Good.
And which I'm going to do that. And I do wear another hat, and that is the National Secretary of another organization which is called British International Doctor Association. And we have members from all over the UK. So I'm going to spread that message to all my medical colleagues as well, and so that each one of them can spread this message to their own locality.
What do you think, after being here for 3 or 4 hours today already, what's the biggest take-home message that you would spread?
Yeah, the biggest take-home message is that we as consultants in our own specialities, and all my colleagues have mentioned to the rest of the community which have come here to listen to us, is to work together, to work in harmony, to understand that medicine is just one part of their health and well-being. There is a whole wide world of other alternative therapies that they can learn about. They not just yoga, but there is allopathic medicine. Apart from allopathic medicine, there is Ayurveda, there is Tai Chi, lots of alternative medicines that they need to understand. At the same time, put it in their armamentarium to choose, so that the public, everybody whom we consider as patients, they can take charge of their health and well-being, and they become responsible and get involved in all this.
I mean, I think if I'm reading that rightly, it's more about community acceptance, community engagement, and offering people a choice.
Yes.
I mean, even in the Mela today, and I've been to 2 or 3 of them, is that we've even got active reflexology.
Yes.
Which is something that you mentioned as an alternative approach.
Exactly, that's the message. That yes, medicine or the hospital medicine the NHS offers is part of the treatment, but preventive medicine, for example, we often forget about, is about health, about fresh air, about outdoor exercise, about teaching our children all the good habits is paramount.
That's a very good point.
And I'm pleased to say that health and well-being has now become part of the core curriculum in schools. And that's a new thing. And I want that core curriculum to be part of everyone's daily life now.
Well, I think that if you sort of look over your left shoulder, you'll see a group of children that have come from around the UK and have created posters to promote, raise awareness for certain aspects of health and well-being. So it's happening. What you're saying
it is
actually
happening.
happening.
In fact, what I would suggest, us take it a step further, if it's part of the core curriculum in schools of the UK, why should it not become a core curriculum of the medical universities as well, all of them? And I think every doctor should be aware that there is alternative therapy, and people can, the doctors of the future can learn about it, and they can spread their messages as well.
Thank you very much for your comments. I hope the right people listen to your statements. So have a good afternoon. Thank you.
And good afternoon to you, Ian.
Thank you.
Thank you very much.
Hi, my name is Ian, so welcome to the Health Mela in Preston for 2023. So if we start with yourself, just if you want to tell me your name and where you're from?
Hi, I'm Anu, I'm from Bradford.
And what's brought you here today? What are you showing?
I came here today to promote overall awareness about the psychiatric condition Munchausen syndrome. And I'm doing that because I'm currently undertaking an EPQ in this field, and I thought it would be a brilliant opportunity to showcase all the information I've learnt about it.
Excellent. Are you learning anything from the visitors to your stall? Are you helping them to understand?
Oh, definitely. It's been really rewarding seeing people learn new information about a condition they'd otherwise not heard about.
Excellent, excellent. Hi, my name's Ian.
Hi, my name is Rakshit Rathish. I'm from Leeds, and I'm here to learn more about the pathways that I can take when stepping into a career in healthcare.
Excellent. Do you have any ideas in mind yet?
Yes, very much. I've seen different paths such as the cancer hospices that have really interested me.
Excellent, good. So I hope you can take away lots of nice new information there. Hi.
Hi, I'm Sammy, I'm from Derby. I've come here to educate the public, I guess, about physical activity and why it's important. And the reason I've done this is because of my previous studies I've learnt that not enough people are taking part in physical activity, so I thought this would be a really good opportunity to let people know about it more.
And what do you think the reaction has been from people?
It's been positive so far. I've been able to tell people a few benefits and about how it can help you as well, so that's
Very
good.
Well, good luck this afternoon.
Thank you.
And sorry, introduce yourself.
Yes, my name is Dr. Anand, and I'm a psychiatrist. I work in the NHS. I like to promote health to children from a young age, and that's what we have done today. We brought about 12 children from all over the country who have spent so much time doing posters and then coming and talking to the public.
What was the reaction from the children when you first put the idea on the table?
Initially they were hesitant, but today seeing the joy on their faces, it has really given them self-confidence and also hopefully some sort of educational take-home messages for them as well.
Excellent. So do you think this is a springboard maybe to next year and the year after?
Definitely it is. I'm hoping that this will encourage them to take up healthy aspects, and then even many of them are interested in a career in health in future. So hopefully they will continue carrying that.
Good, good. Thank you very much. Well, good luck with everybody and have a nice afternoon. Okay? Bye-bye now. Good afternoon. And who do you have the pleasure of speaking to this afternoon?
So when you say you're asking about me?
Yes,
So
please.
I'm Dr. Rajiv Gupta. I'm a consultant pediatrician, but I'm also global coordinator for the NFHW, the National Forum for Health and Wellbeing.
So, how many of these melas do you actually sort of, not so much attend, but actually construct and build and deliver?
So these health mela have been happening for nearly 22 years now. So we just celebrated 20th anniversary, and during the COVID we couldn't have it. So I have converted all health melas to online melas. So we had speakers exactly as they will be there, and the speakers will be talking on different. We clipped them together and did live telecast on the YouTube.
I have to say I was attending a couple of those myself over the past 2 or 3 years, so I did a very good job, so well done to you. Yeah. So how have you seen them, how do you see these events grow?
They were small, it was like a Gujarat Hindu Society, tiny, small one, and it was kind of trying to help the community.
Yeah.
And then it says that there is more need, so they need to have health check, they need to have health advice. People don't know there is so much of facilities available. So the CCG wanted to come in, the dentists want to come in and share breast screening, cancer screening, bowel, and other voluntary sectors. So this has become, I mean, this is a massive size. We had 67 stores here now today.
2023?
Yes, yeah? Exactly. And then in addition, the health check, the posters, we're talking young boy. This is a new initiative we started this year, that people, the young people from come all over the country, from Derby, from Oxford, from Banbury,
for today's event.
For today's event.
You must feel very pleased at that.
Excellent. And the reason is that we, for whatever reason, are not going to be here in 25, 30, 40 years. So changing them and their mindset in order to think about how the community health can change in future.
I think that the obstacles that you're raising there, which is developing interest in the younger people, not only applies to health, but I think life in general, in the difficulty of that. So have you guys been trying anything special to get people involved?
So correct. So we have told them they choose how they choose a topic and prepare a poster. So that poster is being judged by 3 eminent people, and out of those who have displayed 3 best, we will give them extra award.
Excellent, excellent.
And anybody who has prepared the poster, we will give them a certificate signed by Professor Umesh Gupta and myself as a sign of appreciation, because they have done a lot of hard work.
That's very good. I'm sure there's quite an inspiration having sort of been recognized for their efforts. So well done on the organization.
And the other part is also, it's not just them, they have talked to their family, so their family have come here now. They have talked to their teachers, they have talked to their friends. So already that health education, which is one of the biggest motive of the National Forum for Health and Wellbeing, is being achieved through the younger generation now. So they are going to be involved, they're interested now, they will be interested in future. They are already talking in their school, they are already talking their future. So that health education is going.
So do you think they'll be back again next year?
Yep. Bigger, better.
So thank you very much for your time, and have a nice afternoon. Thank you. Anita, good afternoon. So what brings you then to the health meeting today?
Afternoon. This is the first time I've come this is the first time I've come here. I am a GP with special interest in women's health, and my aim is not only to promote but also to maintain women's health. What I would like to say is that women's health has been neglected for a long time, and that was the main reason I wanted to come here and promote and raise awareness of my charity, which is endometriosis charity.
Excellent.
Which I developed 2 years ago.
Very good. So what would you like people to take away?
So I would like people to know about what endometriosis is. Endometriosis is a debilitating condition, and women suffer in pain. 1 in 10 women suffer from it, and it takes 7.5 years to make a diagnosis. The reason is because they are not asking for early help. So they are suffering in pain but not seeing their GP and asking for special test or for a referral. So my aim today is to raise awareness, to empower women so that they do not suffer in silence.
Very nice, a very worthwhile attitude there. So are you surprised? What do you think about the numbers of people that are here today?
I'm really surprised. It's such a good number, and like I said, this is the first time I've come, and seeing so many people, so many stalls raising awareness of health and well-being is really, really amazing.
So how far have you come today then?
I live in Rochdale, so it took us about an hour.
So that's a reasonable distance then?
Yes.
That's good, good. So in terms of what you've brought to give people today, have you sort of brought anything physical, any literature or anything special preparation?
Yes, so I have got leaflets. The leaflets give patients an information what signs and symptoms people could suffer with when they have endometriosis and what to do, when to see the GP, and if they are in such a lot of pain, when to attend the A&E. So yes, I have got leaflets which I'm distributing.
Have you had a chance yet to speak to any women, any females about the...
Only 2 women who came to my stall. They've never heard of endometriosis.
Really?
And I'm hoping to raise awareness to men as well. It's the men who also do not know what endometriosis is, and when they see their wife, the partner or the daughter suffering with pain, they think it's just a normal pain.
Excellent.
So
okay.
Men have to be trained too. Thank you.
as with most things. Right.
Yes.
So thank you very much for your time and good luck with your challenge.
Thank you.
All the best. Bye now.
Thank you. Bye-bye.